Assalamu alaikum wa rahmatullah. I am Dr. Hamid Hussain, consultant physician, Dubai Health Authority. Good afternoon, everybody. This afternoon, we are going to focus on to deliver a workshop on evidence-based medicine and effective reading of clinical paper. So this issue, actually, it's important issue for everybody because we are always searching for the evidences. These evidences, we are going to use it in our daily practice to improve the health care, to also try to apply effective treatment, and also there are many benefits from being aware about the critical appraisal. So that we need all of you to be engaged in this workshop. And if you have any questions, when we are going to discuss what are the main principles and how we can read the literatures effectively. And if you have any questions or discussions, then we are going to be open for these questions. So in general, we are going to cover the following areas. What's clinical evidence? Steps in criticizing clinical article, strengths of evidence, levels of evidences, levels of recommendations and the power of the recommendation, what is systematic review, what's meta-analysis, and what's Cochrane review. So to talk about clinical evidence, it's a piece of scientific work that all of us, we need to be aware about it because it is generating by the research work and by effect of the researchers and by the effort of the researchers. And this evidence is going to be utilized in our daily practice to improve the care and also to apply effective treatment and to avoid harmful practice as well. So that clinical evidence is very important for each of us, and we need to know while we are reading the literature to know how we can identify the effective evidence and how we can assess this evidence, whether this is the level 1 or level 2 or level 3, and how we can utilize this evidence in our daily practice to improve the care. So this is in general what we are meaning by the evidence, and in general, how we can read the clinical article. So I would like to say that today's medicine practice is almost based on the generating of the evidences. So when we study medicine at 80s and 90s, it's totally different from nowadays medicine. This is all because of the accumulation of a lot of evidences, and based on these evidences accumulation, the face of the medical practice has been changed totally. So that generating evidence is very important process, and we all need to know how we can identify these evidence from the clinical literature and how we can apply these evidences in our daily practice. So in general, the literature divided into two parts. The first part is the filtered information or filtered literature, and the second part is the unfiltered literature. So the filtered literature, usually they are the systematic reviews, critically appraised topics, evidence synthesis and guidelines, critically appraised individual articles, and the unfiltered information is randomized control trial, cohort studies, case control studies, case series reports, and we have also what we call the background information or experts' opinion. So the critical appraisal, the evidence-based medicine is divided into three areas: the filtered information, unfiltered information, and the expert opinion. So all of them, they are very important, and we all need to be aware about what are the details of each of these. Okay, so all of us, we are exposing to a huge amount of clinical literature every day. And there are a lot of clinical literature producing every day by researchers in our setting, in our local community, at the national level, at the regional level, at the international level as well. So always there are a lot of knowledge produced, there are a lot of articles published, and these articles, we need to know how to read these articles and to criticize these articles and to identify good evidence from similar articles. So to start with how to read the articles effectively, we have to start actually with, first of all, where this articles has been published. So first of all, we need to look to the journals that this article has been published, because there are different levels of the journals in terms of the solidity of the evidence, in terms of the power of the evidence. So there are some, and to know what's the weight of this journal, we have to know what we call the impact factor of the journal. Impact factor of the journal. So as much as the impact factor of the journal is high, it means this journal is high standard, and they are only accepting the high level of the scientific works, and they are only publishing the high level of the scientific works. So first of all, we need to know in which journal this article has been published, and from this we can also give some sort of weight and evaluation and assessment for the quality of the research, because publishing a research in BMJ and Lancet and other very high standard journals, it's totally different from publishing of the articles in other journals like daily journals or Predators or whatever. So first of all, we need to assess where the article has been published, and from this we can say that this is a high standard and high level and high quality article or not. Okay, after we finish this, in what journal the article has been published, we need to look to the article from the first point, which is the title of the article. And the title of the article, we need to see whether this title is relevant, it is focused on certain topics, it has a high scientific value. So from the title, we need to look to some of the criteria and some of the values that will tell us whether this article is going to be a powerful article, important article, or not. So looking to the title of the article is very important step in criticizing the literatures, and we need to focus on the title and the relevance of the title, the importance of the topic, the scientific background of the topic, so many criteria we need to look from the only title. So after the title, we will come to what we call the authors. Who are the authors? Where are they working? In which centers? In which academia? In which place? Because this also will reflect to us whether the people who are publishing and who are developing this kind of article, they are working in highly advanced centers or clinical settings, where we can say that from their affiliations, from their names, that they are high standard people, and they are producing a high standard article where it's going to generate what we call the good evidence to be utilized for in our practice. So again, we need to look to the authors and the affiliations of the authors, which is very important, and to make assessment for this point. After that, we have to look to what we call the introduction part of the literature, introduction part of the paper. In the introduction part, we have to classify the introduction into 4 areas. In which area we need to make some sort of assessment. The first area is the statement of the problem, whether the statement of the problem is clear in this article, and it's relevant, it's focusing, it's scientific, it has high value or not. All these questions we need to look to when we are going to assess the introduction part And the first part of the introduction, which we call it the statement of the problem of the statement of the problem. After the statement of the problem, we have to look to the importance of the problem, the public health importance, the clinical importance, the social importance, the economical importance of the problem, and we have to put an assessment for the importance of the problem to say whether this problem is highly important, it's medium level important, it's not important. So we need to classify whether this topic is very important topic or not, from looking to the importance of the topic. After that, we need to look to the distribution of the problem, whether this problem has been tackled by different literatures in different places, in different clinical settings. So we need to look to distribution of the problem, the size of the problems, its distribution at the local level, at the national level, at the regional level, and at the international levels, to see how much this problem is big or small or medium or effective or whatever. So this distribution of the problem is very important also. We have to look to distribution of problem in the introduction part. Now, the other part of the introduction, we need to look to the justification and rationale, why this article has been developed. Is there any rationale? Is there anything behind this article? For example, usually the people, they are doing articles because they need to do what we call filling gaps in the knowledge, or adding values, or answering research questions, or testing research hypotheses. So there are so many justifications and rationales behind why the people, they are usually doing developing research work. So if we can look to this part, and we can find that there is a good research questions in this article, then this article is going to be a good article and is going to produce a good evidence as well. If we can identify that there is a good research hypothesis in this article, then it's going to be a good, it's going to generate a good evidence at the end of this article. So we have to look to the research questions in the article, whether this question is a scientific question, is a big question, is an important question. This question is going to address a gap in the knowledge, is going to add addition in the practice. So if there is a good research questions in the article, it means that this article is going to be a good standard article, is going to generate a good evidence as well. We also need to look to if there is any hypothesis in this article, which is, we call it research hypothesis. And actually the hypothesis, we have two types of the hypothesis. It's the text hypothesis and the statistical hypothesis, which is usually the hypothesis, we call it assumptions. It's the assumption of the researcher that he assumes something and he wants to say, to test this assumption, whether it's true or it's false. So if there is a good research hypothesis in the article, it means that this article is going to be a good standard. It's going to generate a good evidence at the end of the day. So, and as I told you, the hypothesis, we have two types of hypothesis. It's text hypothesis and statistical hypothesis. And in the statistical hypothesis, usually it is what we call the null hypothesis and the alternative hypothesis. The null hypothesis, usually it's saying that there is an association between exposure and outcome. So usually we have exposure and we have outcome. So if there is, we assume that there is an association between exposure and outcome. If we can approve this, then this is going to be accepted. If it's rejected, then we have to go to the alternative hypothesis, which is saying that there is no association between exposure and the outcome. Now, testing this hypothesis, we should apply what we call the statistical analysis test. And we have a lot of statistical analysis tests should be applied to test these hypotheses. Like, for example, we have what we call the T-test, and we have chi-square test, and we have F-test, and we have analysis of variance, which is ANOVA test. So we have a lot of tests, statistical analysis tests, to be applied to say whether this hypothesis is a valid hypothesis, it's an acceptable hypothesis, or rejected hypothesis. So we need to apply some sort of statistical analysis, which is the t-test and chi-square test, f-test, analysis of variance. Each one of these tests has its own indication, and now we don't have enough time to say when we use t-test, when we use f-test, when we use. But these tests, usually they are used to test what we call, to prove that the hypothesis of the research is acceptable or it's rejected. So we have to apply what we call the statistical test. Now, what we need to look also in the literature, in the article after the hypothesis, we need to look what are the objectives of these articles. Actually, we have two things. We have the main of the research and the aim of the research, and we have the objective of the research. So the aim of the research, usually it's a broad aim, but the objectives should be specific, smart, measurable objectives. So if there is a good aim behind this article, if there is a good and smart objectives behind this article, then we are going to end with what we call good research design, and this paper is going to produce a good evidences. Now, the most important thing that we need to look in the article is the methodology part. And in the methodology part, we need to classify the article in different items, in different subtitles. The first subtitle is the study setting, where we are carrying this study and when. And this is very important, because carrying of the article in Rashid Hospital, for example, in Dubai, is totally different from carrying the study in USA or in Europe. So study setting, we need to look what's the study setting behind this article, and when and where this article has been carried out. Now, after study settings, we need to look to what we call study design. So what kind of design has been allocated for this study? And we have different types of the design. And from this design, actually, we can conclude whether this study, whether this evidence is going to be generated by this study is strong evidence or not. It's all depend on the kind of study design has been adopted by this paper or by this article. So in the study design, usually, we have many types of design. We have what we call the interventional studies, and we have what we call observational studies. So in the interventional studies, we have usually what we call the animal experimental study, and we have randomized control trial, and we have randomized trial without control, and we have quasi-experiment, which is some sort of randomized trial also, and we have therapeutic trials, we have preventive trials, we have prophylactic trials. All these, they are some kind of study design, which is very important in assessing the certain drugs or medication or vaccination or preventive program or whatever kind of intervention, we can assess it by what you call the interventional study, which means that we expose the people to certain program or to certain medication or to certain vaccine, and then we see what's the outcome of this exposure. So this is, it comes usually through what we call the randomized control trials. Now, the other types of the study design are the observational studies. The observational studies, usually they are, we have cross-sectional studies, we have case control studies retrospective, we have case control studies prospective, and we have cohort study, also retrospective and prospective. So these are the all types of design we call observational studies or observational design. We don't have any intervention. While the first group, which we are having intervention for the patients, we call interventional study. So two main designs, the observational studies and the interventional studies. This is when we are going to collect primary data. We have another design of studies when we have secondary data. When we have secondary data, it's going to be what we call retrospective records review. So we are going to take the informations and all figures and all data from the records, like for example, electronic medical records or registry books or clinics or whatever. So when we take the data which is already collected, this kind of data, we call it secondary collected data, while the data that we are going to collect it, we call it primary data, and the design is observational design and interventional design. Now there is one of the studies we design, we call it systematic literature review, or this systematic literature review, or what they call it literature review, when you are going to see number of articles published and then collect these articles based on certain criteria and make assessment for these articles and then make some conclusions on revising of these articles. This we call it systematic review, and when this systematic review used with some sort of statistical analysis, then it is going to be systematic review plus statistical analysis. This kind of design, we call it meta-analysis. It is a meta-analysis design. So these are all kinds of designs that all the researchers everywhere in the world, they are using one of these designs usually. Now each one of design has its strong points and weaknesses also. But there is no time here to discuss each of these designs in details, but you need only to know that these are the kind of the designs available, and each one of the researchers is going to use one of these designs in general. So, and we have what we call the research strategy, whether the article is quantitative articles or qualitative articles. So we have two types of research strategy, is the quantitative studies and the qualitative studies. When we are dealing with the figures and doing analysis of these figures, then this is a quantitative study. And when we are dealing with the points of views, with the feedbacks, with the experts' opinion, then we are dealing with what we call qualitative studies. So there is a qualitative approach and quantitative approach. This is what we call it the research strategy. So we have research study design, we have research strategy when we need to be aware about all these things, when we are carefully reading and carefully criticizing the literatures and looking for evidences. Okay? And in each article, we need to look to the sampling, how the researcher do the sampling. Actually, there are 2 points in the sampling. They are what we call the sample type and the sample size. How is the sample size adequate? Is it random or not random? So the best sample size usually in the article, to make this article strong, it should be a random sample size and it should be adequate sample size. There are 2 points which is very important. It's a random and the adequate. Random, it means that each unit in the sample has the same chance to appear in the sample. This is, we call it random. So we have 2 types of samples. We have probability samples and non-probability samples. The probability samples is the random sample, while non-probability samples, they are non-random samples. The best samples in the studies are the probability samples, which are the random sample. Okay? The non-random sample is usually, there are some bias in this non-random sample. So we need always to be careful that the best sampling in any research, in any studies, in any article is the random sample. And we call it the probability samples, and we have different types of probability samples. We have simple random sample, we have systematic random sample, we have stratified random sample, we have a cluster random sample, we have different types of samples, and each one of these samples has its significance and has its advantage and disadvantage. So we need to know what kind of sample is there, and if this sample is a powerful sample or not, and whether the sample size is adequate sample size or not. Because the small sample size, usually it will go with what we call a lot of bias and a lot of errors. While the larger sample size is going to be costly, we need a lot of efforts, a lot of logistics, a lot of budget. So we don't need large sample size, we don't need small sample size, we need what we call adequate sample size to avoid the errors. So we need to look whether the sample size used by this article is adequate or not. So we need to look to the sample size and to know whether this sample size is adequate or not, to see whether this article is a good article, it's going to produce a good evidence, we can use this evidence, we can generalize this evidence, and we can improve our practice and improve our healthcare every day. Okay? So this is regarding the sampling. Also, you need to know in the methodology what kind of methodology this researcher follows. You need to look also to what we call the inclusion-exclusion criteria. Who are the people who are excluded and included in this study, and who are the people who are excluded, and why we exclude this group of people from our study. And because we need, first of all, to identify what we call the target population. Who are our target population? Our study is going to be carried on upon which population? This is, we call it target population. And from this target population, we will take the sample. So how can we take a sample from the target population to be representative to this target population? So we need to know what are the target population. Is that this target population is a correct population? How much we are going to take from this target population as a study population, and what kind of techniques we use in this study population. All these important issues for you when you are going to read the article to see whether this article is a strong article, it's a scientific, the researcher applied a lot of scientific principles, scientific approach. If you know all these things, you can assess this article to say whether this article is good or not. If it is good, then it's going to produce what we call, or generate what we call a good evidence that can be utilized in our daily practice. Okay? This is what we call, this is what is related to the inclusion-exclusion criteria. We have another issue to talk about it, which is operational definitions of the variables. What kind of variables this researcher used? How many variables? How he defined this variable? Based on which criteria? Based on which definition? From where he got this definition? From which reference? Which organization, which scientific society gives this definition? For example, hypertension definition and WHO, it's different from hypertension definition and American Heart Association. So both of them, they are giving different kind of definitions for hypertension. So what kind of operational definitions of the variables this researcher used in his article, and what kind of reference he took this operational definition from? So here, is he mentioned this reference when he used this operational definition of variables? And after that, we need to look what kind of, how he did the data collection, what we call the data collection. What technique he used in the data collection. Is it self-administered questionnaire? Is it interview questionnaire? Is it online questionnaire? Is it home visit? Is it what kind of data collection procedure this researcher used? Because each one of these procedures in the data collection, it has its own advantage and disadvantage, and we can say this kind of data collection is going to be strong data collection, high quality data collection. Because the data is high quality, then it's evidence that we can utilize it. You need also to look to what kind of statistical analysis done this researcher applied to this article. And we have different types of statistical analysis plan. We have descriptive statistics and we have inferential statistics. Whether this researcher applied only descriptive statistics, like, for example, measurement of central tendency, mode, mean, median, average, sample deviations, variance, or he used inferential analysis, which is related to the statistical hypothesis, F-test, chi-square test, t-test, correlation analysis, regression analysis, logistic retouching, multivariate analysis. What kind of analysis this researcher used in his article, and how he would use these tests, these statistical analysis tests. And also we need to know at which level of significance this researcher test is data. Is it at the 95% level? Is it at 99% level? Is it at 90% level? What's the p-value? Is it less than 0.05? Is it more? It's more than 0.05? Is it less than 0.01? All these things are very important because the very important, the very high power of the evidence to be generated should be tested at a very high level of significance, which is at the 99% level of significance, which means that p-value should be less than 0.01 only. So we need to look to all these findings, to all these evidence, to see whether this kind of analysis was valid analysis. This kind of analysis was valid analysis, was strong one, and he applied this principle, this statistical analysis principle effectively and in a proper way. So looking to these findings is very important, because based on this we can conclude that this kind of analysis applied in this article is valid analysis, it's strong, it's effective, and we are going to expect that based on this, they are going to generate a solid and high value evidence, which we are going to use it in later, because the best evidence is that the evidence we can generalize it. It can be used everywhere in different clinical settings, even if it is generated in one setting, but it can be generalized to other settings, whether it's at the local level or general or national or regional or even international. And you all remember that when COVID-19 crisis started, because research work usually it's a long-term work, the people at the first period of time, they couldn't find any evidence to use, because there is no any kind of research has been carried out. So most of the experts, most of the physicians, they use their own opinion, their own personal experience. So until almost 6 months or one year, the people, they keep changing the protocols, treatment protocols, interventions. Every now and then something happen new, and some people, they are telling some new procedure and some new medication, and they keep changing all the time until the research work started and the solid evidences has been generated and starting to be utilized and applied in the new protocols and new guidelines. So based on this, we need also to look to the data presentation. How this article presented the data. Is it scientific presentation? What are the most significant findings in terms of the highest findings or in terms of the lowest findings? What is the meaning of these findings? Okay. So, and what's the meaning of these findings? So we need to look carefully to the data presentation, and we need to look to the findings, and we need to look to what we call the the relevant findings and the significant findings. Because sometimes we end with a lot of details. We don't need to look to all these details. We need to tackle the most important, relevant, and significant details, whether the researcher was managed to present it in a proper way or not. And then we need to look to what we call the interpretation, how this researcher interpreted his findings, and whether this interpretation was valid interpretation, whether the findings was filling gap in the knowledge, is there any additive value from this research or not? All these questions we need to answer when we are reading the literatures, because we need to know at the end how much this literature is strong, how much this literature is effective, how much this literature capable to generate evidence that we can generalize and we can use to improve our healthcare quality, or to use effective treatment, or to avoid harmful effect of bad practice. So these points, every one of us, we need to remember it when we read any article. Actually, reading articles needs skills. I mean, when the people, they read articles, they need to develop some skills, how they can read the articles in a proper way. Because at the end of the day, when you read the article, you need to come with some sort of conclusion. You need to come with what we call, what's the benefits of this article? Is there any new in this article? Is there a questions that this article answer? Is there a hypothesis that this article test? What's the implications? What's the recommendation? What's the conclusions? All these points needs to be assessed, needs to be evaluated when we read the articles, and when we evaluate the articles, and when we criticize the article. Then after that, you need also to look to the limitation of this article. What are the limitations? Because there is no perfect article. I mean, always, all the literatures, there are some limitations. So we need to look to what kind of limitation this article encounters and face. There are a lot of limitations, maybe related to the sampling, maybe related to the quality of the data, maybe related to the logistic issue, maybe related to so many limitations. So the good researchers is the researchers who is usually appreciated and acknowledge the limitations. So when you find the limitation in the study, it means this study is a good study, it's a powerful study. Then you can trust this study, and you can say that this study is going to be a good generator for the evidences. Now, the other point is that, is this study raising new questions? Because in the literature, usually you have your own research question. You need to answer this research question. But at the end of the study, you need to raise another question, which is going to be raised for the other people to work on it. So the good study is the study that answering question and also raising another questions for the other people. So this is very important. When you find that this study is raising new questions for the other people, to recommend it for the other people, it means this study is powerful, it's a good study, it has a good vision, it has a good insight also. You need to look also to what kind of references this study used. They are strong references, they are updated references, the references is very important, because the good study is the study that utilize a lot of good references from the literature and discuss the results with a lot of good literature also, the finding of the literature. So referencing also, you need to look what kind of references, the dates of these references, and from which journals these references has been used. Then after that, you can look to what we call the conclusion. What kind of conclusion has been generated from this study? And the conclusion, actually, it is what we call the evidence. So it's the last point in the research that this study is going to conclude something, which is, we call it the evidence. And here we need to know what evidence has been generated in this study, and then we need to assess the level of this evidence. Actually, we have 3 levels of the evidences. In each article, we have evidence 1, evidence level 2, evidence level 3. In the evidence level 1, we have evidence level 1A, evidence level 1B, and then evidence level 2A and evidence level 2B, and we have evidence level 3. So when the study is meta-analysis, we have then evidence level 1. Meta-analysis is evidence level 1. When we have randomized control trial, this is evidence level 1B. So evidence level 1A is meta-analysis. Evidence level 1B is randomized control trial. Evidence level 2A, it's a control, case control, retrospective or prospective. Evidence level 2B, it is randomized trial, uncontrolled. Randomized trial, uncontrolled. And evidence level 3, it is the other studies, cross-sectionals, experts' opinions, reports, whatever. So these are the 3 levels. The most strongest level is the level, evidence level number 1, number 1A especially. So when you find number 1A, it means that this evidence generated by this kind of design, by this kind of study, is the most strongest evidence that can be used, and you can modify your practice, you can modify your protocol based on that, and you can generalize it to all clinical settings everywhere in the world. So you can categorize the level of the evidence. Based on this categorization, you can say which one is the most strongest and which one is the less, and which one the less, and until you reach to the last level, which is the level number 3. Okay? So this is the kind of how we can classify the level of the evidence. And what does this mean, level 1? What does it mean, level 2? What does it mean, level 3? And what are the importance of these levels? You can also based on these levels, go to what we call the recommendation. Then you have now evidence, and on this evidence you need to do a recommendation. Well, for example, the recommendation is to change the management protocol or to modify the management protocol with certain types of modifications. So again, we have 3 types of recommendation. Recommendation A, recommendation B, recommendation C. So recommendation A is going to be based on the level 1 evidence, and recommendation B is going to be based on the level 2 evidence, and recommendation 3 is going to be based on the level 3 evidence. So we have classification of evidences, and we have classification of recommendations. And based on these, you are going to change your practice, medical practice. For example, you have certain protocol, and then there is new generation of evidences, and then you can use these evidences to change the protocol and the treatment, or what kind of intervention that you are doing with the patients. So based on this, you can change your, and that's what is going on actually in medical practice. So every day we have a lot of evidences, so that a lot of protocols appear again, new protocols, modified protocols, a lot of new guidelines, and you can see there are guidelines sometimes updated every year, or every 2 years, or every 3 years. These are all based on the evidences that has been generated by the articles, generated by the literatures. So based on this evidence, protocols, guidelines, practice, whatever, all usually changed. So this is briefly. There are a lot of things behind each of these points. If we have time, we can discuss more. But there is one thing I need just before I end my talk to tell you, is what we call the Cochrane Review. And it's some sort of literature review. It's a network, this Cochrane Review. It's a network which is based in different places of the world. We have also here in the Middle East, in Bahrain, the headquarters of Cochrane Review. It's a group, scientific groups that are asking some people who are researchers, who are clinicians, to work on evidences in certain areas. For example, evidences in oncology, evidences in gynecology, evidences in internal medicine, cardiology, whatever. So there are small groups that are of researchers, scientists, clinicians, they are working of looking to the different literatures to identify evidences and to formulate these evidences. This Cochrane review is a very scientific approach to identify the evidences for the changing practice, for implementing these evidences in our daily practice, and make some sort of changing in the protocols and in the guideline and in the practice. So this is briefly how we can read the literatures, what things we need to look in the literatures, what things we need to assess, to evaluate, and how we can say that this article is a valid, is a strong, is important, is a scientific, and we can say whether the evidence generated by this article is strong evidence, it's level 1A or level 1B, level 2A or level 2B, level 3, and we can say what kind of recommendation we can do here, whether it's A recommendation, B level recommendation, C level recommendation. So these are, in general, how we can read any article effectively, how we can criticize the article effectively, and how we can get benefits from any article. Because reading articles is not like only reading and that's all. You have to have what we call the effective, scientific, and inciting reading, and you have to have what we call the scientific vision in reading articles and how you can get benefit from these articles. Thank you very much. These are briefing how evidence-based medicine can be done and critical appraisal can be done. If you have some questions, we can do some sort of open discussions, and we can give a lot of more information about these things that we mentioned.
Dr. Hamid,
تفضل.
كيف الحال?
الحمد لله.
Always nice to hear from you.
Thank you.
So now we're discussing the evidence hierarchy and the use of evidence in guidelines. But why do we see that sometimes the guidelines do recommend something, and after a certain point, those articles were recommended by the guidelines, but then they go and downgrade their recommendation according to the change in the studies, or I mean, were the studies not good, or were there any contraindications that was used in these studies and then elaborated later and seen later?
Yeah. Well, actually, I said, I mean, medical practice is always changing by generating of medicine, of evidences. And every day we have a lot of evidences because there are a lot of research work going on everywhere in the world. So there are many researchers now, at this point of time, they are doing their own research. And at the end of the day, they will produce new evidences. Now, if this evidence is a strong one, it's at the level 1A or 1B, or it's strong, then it's going to be generalized. When it's going to be generalized, it's going to be administered or introduced to the protocols and guidelines. Now, this guideline does not mean that at this point of time, this guideline is valid, but it's not valid in the future. It's not valid after 1 month or after 6 months or after 1 year. We don't know. If new evidence generated from further studies, from other studies in the future, then it means that if new evidence appear from the future studies, then it means that the new evidence which is going to be generated has to be included in the guidelines. So the guideline need to be updated, or need to be upgraded. This is one. Two, sometime even in the guideline, there are what we call acknowledgement of the limitation. They can use the evidence, but they said this study, which has generated this evidence, still has this kind of limitation. So they are acknowledging and appreciating the evidence, but at the same time, they are acknowledging the limitation of this study. So they are trying to recommend further work to close the gap, the current gap in the knowledge. So the further work will produce new evidence which can close the gap in the knowledge.
Doctor, say as a physician or as a clinician, when we see these change in evidence, let's take, for example, the chloroquine as a part of medication being prescribed for COVID patient in the initial phase, and then later on was removed. As a physician, these change in evidence may sometimes allow you to lose trust in studies. So what do you think about that? So we start the chloroquine, then they say chloroquine is not good, not beneficial, the studies were not good. So as a clinician and you're working in the field, so do you recommend personal criticizing the articles, or should you go onto guidelines, waiting for guidelines to criticize for you the articles?
Okay, that's a good question. I mean, in the evidence-based medicine, we have 3 levels. We have the filtered information, unfiltered information, and opinion of experts. So opinion of experts, still it's part of the evidence-based medicine. If you don't have, that's what happened exactly in the first phase of COVID-19 crisis, where there is no any literature has been produced so far. So the people, they were trying to use their own point of view and personal experience. So up to the first 6 months of the COVID-19, there are a lot of ideas generated by many physicians based on no research work, based on their only expertise and daily practice. So still the expert's opinion is part of the evidence-based medicine, but it's a weak part. It's not very strong part. The very strong part in the evidence-based medicine is the research work. What kind of research is the highest level and the highest standard of research, which I mentioned? The best one is the meta-analysis, which is systematic literature review plus statistical analysis. So this gives us the best and the powerful and the strongest evidence in the evidence-based medicine, while the expert's opinion is the lowest level. But when you don't have any time or logistics, or your circumstances is not adequate or not allowing you to produce the evidence by research work, then you can use what we call the expert opinion and their experience from daily practice also. But this, it's not very strong one, but it's acceptable in the evidence-based medicine.
One more question, Dr. Hamid, with regards to the Cochrane review. The Cochrane review's conclusion about any topic is very minimal because it adds a lot until it comes to most of the recommendations is against doing this or against. So until they reach to a conclusion that yes, to do this, that takes a lot of time and a lot of effort from them because they need to exclude a lot of studies, they include a lot of studies.
Yeah.
So do you think we should depend only on the Cochrane review? Or
well, it depends. I mean, whether this evidence is level 1, it's correctly, the literature has been correctly revised. I mean, the people who are working on this evidence, they are competent, and the methodology they use, it's adequate and scientific methodology. So if all these things available, and they work on certain evidence and they generate this evidence based on all these scientific criteria, then why not? It's solid evidence at this point. But correct that the Cochrane review, they have their own limitation also. They have their own challenges. But in general, I mean, if the team is work on qualified team, work on literature review, and collect a lot of literatures, and look to these literatures and manage to identify a good evidence from this literature on scientific criteria, on scientific base, then this evidence is going to be good evidence, which can be used.
Thank you very much,
Thank
Dr.
you.
Hamid. Thank you.
Thank you.
I think we came to the end of the session, Doctor. Thank you very much for joining our conference of internal medicine. We hope, inshallah, in the future we have a bit more active sessions with in a better timing, inshallah. Thank you very much for attending, Doctor.
Thank you very much. Thank you.